Good afternoon, everyone. I want to welcome you to our webinar today as we discuss COVID-19 and how it relates to Snyder ISD. We've already received several questions from parents, but if you have a question that you would like to ask, you may do so by typing it in the Q&A. You'll see that typically at the bottom of your screen. Of course, you can always reach out to us anytime by calling the office here, or you can email questions@snyderisd.net. I'd like to welcome our panelists that we have on today. We have Dr. Eddie Bland, Superintendent of Schools. We have Wendy Prince, registered nurse for Snyder Primary School. We have Kathy Scott. She's our Director of Instructional Services. And we have Jerry Ashley, who's the Assistant Director of Operations. My name's Valerie Morris, and I'm the Public Information Officer for Snyder ISD. So we're going to get started with a list of questions that have been submitted. And again, feel free to type in a question if you have one during the call at any time. Okay, so the first question that I have here is, I've received a notice that my child had a classroom contact. What exactly does that mean?
Okay, so if you have received a notice that you have a classroom contact, that means that the school district is aware of somebody that's in your child's class that's tested positive for COVID. So those students, of course, if you have tested positive for COVID, then you'll need to go home. They stay home for 10 days and until their symptoms are improved and they're without fever for 24 hours. But we notify the parents of the students that may have been in close contact with that positive case. And the big reason behind that is so that everybody can really keep a close eye on their students, monitor their symptoms, which we hope you're doing every day anyhow. And one of the questions that we have, in addition to that, we've had some parents say, how come I keep getting more than one notice? That happens, and you can see how it'd be really easy, especially at junior high and high school, when those kids are switching around. There's a lot of movement, a lot of different activities. So your child may have been exposed more than once to the positive case. So if you're getting multiple notifications, it's because there was multiple contacts.
That's right, Wendy. And we send those notices out through Parent Square. Typically that comes from the principal or another designated contact on that campus. So that's another reason why it's so important to be plugged into Parent Square, because that is how we are communicating those notifications to you. Of course, if you have a question, feel free to ask as well. You can reply to that post that is sent out as well.
Another thing we want to touch on that is, we do send notifications out for people that we know are exposed. But right now in our community, we have a very high transmission rate of COVID-19. So we want you to kind of be aware and be thinking that you may have been exposed in other places or at school without our knowledge. So again, we want you to monitor your students for symptoms. If they have them, then please don't send them to school that day. Give your campus nurse a call, and we'll give you some guidance and direction of what to do about that.
That's right. So another question that we've got is, how many students are currently have tested positive for COVID, or how many staff members have tested positive? Anytime you can go on our website at snyderisd.net/COVID, and you can see our dashboard, and we update that usually a couple of times a week. If we've had a major change, we might update it daily. Just as those updates come in, you can see how many students and staff members are positive at any given time. And we also break that down by campus. On that page, you'll also find information about our guidelines, frequently asked questions, and links to important resources as well. The next question that we have is, will the school shut down since COVID cases are still rising?
Okay, well, I guess that would be my answer. Right now, we're constantly monitoring our data, and like you said, like Valerie said, you can follow it on our dashboard. This week, we're actually seeing a little bit of a decline in our positive cases that we have at the school, and that's good. That's a good news for us. So we don't have any plans for shutting down. If we see a major spike, we would be in consultation with the county health unit, Cogdell Hospital, taking some feedback. I think the general consensus that kids really do need to be in school. And I saw one of the questions come up, will we be going virtual? And the last legislative session, so last spring, when during the 87th legislative session, the Texas legislature removed virtual schools as an option for all Black public schools. So we can't do what we did last year. They recently came back and amended that, but the parameters they put on offering virtual school, I don't think that Snyder ISD would ever be able to meet those parameters to be able to do it virtual. We understand that you may have concerns, and we will work with you the best we can, but under our current conditions, compulsory attendance is in place, and the state expects the students to be in school. We don't really have an option on that. I know you can contact Valerie through our website, or me. There are some options if you're that concerned about it. The well-being of your child, and we expect everybody to do what's best for their own children. There are some virtual options that do not involve Snyder ISD, and you can access those through the Texas Virtual School Network.
And I'm going to go ahead and pop that link into the chat as well, in case anybody needs to look that over.
And what that would mean, if you enroll in one of the virtual schools that are identified as approved virtual school in the Texas School Virtual Network, it would be similar to homeschooling. You would withdraw from Snyder ISD, but instead of signing to homeschool, you would enroll. You would contact the virtual school, and you would enroll in their virtual school. And then if the time came where you chose to made the choice and want to come back to Snyder ISD, you would withdraw from the virtual school and re-enroll in Snyder ISD for face-to-face.
Okay, so the next question we have is, if the school does not close, can at least be temporarily closed to deep clean it, to get rid of any germs that might still be lingering within the school. So is that something that we should do? Wendy, what do you think about a deep cleaning?
So I know that our custodial staff has been working really hard. They have been above and beyond. They really have. And we rely on them to really keep us safe by cleaning, and they are doing a good job. I think, I don't know if Dre's on here, but I think he has them on weekends doing some additional disinfection. And our teachers are doing daily disinfection. Of course, the nurses are. We're practicing good hand hygiene. But the real problem with COVID transmission, you can get it from touching stuff, but generally you're going to get it from respiratory droplets. That's the main mode of transmission. If you have coughing and fever and any of those symptoms that are listed with COVID, the sore throat, the congestion, then you could be spreading it through respiratory droplets. That's why we really would like you to stay home if you're sick. Additionally, while masks are not mandated in Texas schools right now, it's recommended, and they also really do help with the prevention of transmitting respiratory illnesses. This is something that healthcare workers have been doing for years and years. If you have a respiratory illness and you're coughing, it makes sense, that person that's coughing wearing the mask would spread less germs by wearing the mask. The people in front of you can catch less germs by wearing a mask as well. So we highly recommend a mask. We have masks on all of our campuses. And again, we ask that you stay home when you have those symptoms, because that's the main way that people are spreading it.
Yeah, yes. To kind of go along with what Wendy had said, the custodians are cleaning all the high touch points as much as they can throughout the day. We are also disinfecting with the e-mist machine 2 to 3 times a week at each campus. Of course, we don't want to do that every single day just because, might get immune to the chemical. Also, the teachers also have spray bottles to wear, especially junior high and high school campuses in between class changes. They're spraying down the desk, trying to wipe that stuff down. The chemical that we are using is a 60-second kill time versus what we usually do on cleaning nightly, which is about 3 to 5 minutes of kill time. We are also disinfecting the buses in between bus routes. The buses run routes in the mornings, come in, and we are disinfecting each seat and each bus as much as we can there. And then also our activity buses, whenever they go out, we have an e-mist machine that actually we can put inside the bus, shut the doors, and it takes about 5 to 10 minutes to completely disinfect, shoot a fog through the inside of that bus. And we're doing that as often as we can as well.
That's great. And I know, hats off to the custodial staff. They are working so hard and often unnoticed for their efforts. So we appreciate them very much. Hand sanitizers, that was a question that came up as well. Do we have hand sanitizing stations throughout?
Yes. So at the primary and intermediate campuses, we have installed those dispensers in each classroom. And then also throughout the high school and junior high, we have those in different places. And we also have portable stations that we set up through sporting events at entrances and things like that as when people come in. So, and if there's any that come up, we will add those as needed. We all have also added them as you come into the, when you get aboard the bus, when you board the bus, we also have hand sanitizer there for the students as well.
That's great. Okay. So let me ask this. If a student tests positive, they have to be home for 10 days, and they also have to have symptoms improved and fever-free for 24 hours. Then they can go back to school. Now, the clinic and other healthcare experts say that sometimes people can test positive for up to 3 months after having COVID. If that's the case and the student has to be tested at school and shows that they're still positive, will that student have to quarantine again?
Okay, so COVID is a virus that you can get infected with. Like she was saying, you can show positive for an extended period of time after your initial infection. The 10 days is because 10 to 14 days, you should have your symptoms improved, your fever's gone. And then we're thought to have a little bit of immunity for about 3 months. That's where they get that 90-day window. If your student is positive for COVID, it's important to communicate that with your nurse, because it helps us to kind of keep track of what's going on with our classes and our students and the health of our campuses. But also, if your student happens to get sick again within that 3-month period, then we have a record that there was a positive COVID test done. And if it's within that time period, then we're not going to ask you to quarantine for 10 more days. We're just going to ask you to remain at home while your symptoms persist. So we have guidelines. If you have fever of 100 or greater, then you must stay home for 24 hours without the use of fever reducing medicine. If you have vomiting, if you have diarrhea, and even kids that just have a persistent cough from just seasonal coughs and colds, that we normally get, if their symptoms are not controlled, then we may ask you to keep that student home. But if you have had that COVID positive within 3 months, then you won't be asked to quarantine. And always, we suggest that you get with your healthcare provider. The nurses are doing a lot. We see a lot of symptoms. We do a lot of assessments, but we want you to follow up with your physicians or your healthcare providers to make those decisions. So typically, though, no, you're not going to be asked to quarantine, but we do have to have the test results so that we know that that was a date, to go by. And the doctors are usually giving notes out for that.
That's right. Thank you, Wendy. The next question is, why does the school not do like some other school districts and enforce wearing masks? Some school districts are challenging the governor's order against mask mandates. Dr. Bland, would you like to touch on that one?
Sure. I mean, basically, the district has just chosen to follow the governor's order. It's in the court system right now. We still strongly encourage mask wearing. I mean, I think the data shows that when we were in our protocols last year and mask wearing was part of the mitigation protocols, we actually saw fewer other illnesses within the school. I'm not sure what's going to happen with the other districts that are challenging the Governor Abbott's executive order in the court system right now. And part of it, you'd have to make a decision based on where you are and what your community will support. And that's just the decision that our district has made at this time.
That's right. And like Wendy said, we do have a supply of masks that are available on campus. So if you want for your child to wear one, and I know my child had one and the strap broke during the day, so they were able to go to the nurse's office and get another one. So, that's something to talk to your children about if that is something that you would like for them to do. Next question. Let's see, we covered that one. How can I help my child stay on track if they're absent? Ms. Scott, do you want to take that one?
We'll take that one. I will say the first thing that you would need to do is contact your child's teacher, whether that's at the primary level or the secondary level. Always contact their teacher, let them know what's going on and how they can stay on track. Especially true at the primary. Contacting the teacher and they will help keep your child on track. Our intermediate, junior high, and high school are putting assignments in Schoology. So you could be able, your child could be able to do some classwork through that. Intermediate is asking that the teachers be contacted through Parent Square, and they will certainly get them what they need. And all students, of course, should be reading at least 30 minutes per day, and that will help keep them on track as well. Junior high and high school, with so many different teachers, it's extremely important to contact the teacher and keep those lines of communication open so that students can stay on track. And of course, they are using Schoology as well. Upon return, take advantage of tutoring, other things that they have to get kids back on track. There's an extensive high school schedule on their website for tutorials and Pride Hall that's already scheduled. So that's just reaching out to each campus and keeping in touch with the teacher, I'd say would be the best advice.
Okay, thank you. The next question that came in is, I have 3 children in the high school. When contact notifications are sent, would it be possible for the grade level to be indicated in the message? And that's a very good question, and one that we've looked at different ways of sending those notifications. The challenge is that in high school, sometimes you have multiple grade levels in one class. And so that was difficult. So if you'll look at the top of your Parent Square notification, it will say which class that's for. It can help you narrow that down. I know I have 2 kids at the high school as well, and that's how I'm sorting those out, is by looking at the class and then knowing, okay, so one child has Algebra 1, and so I know that that was for Algebra 1 for this one student versus another. So that's how I'm doing that. It's not a perfect system, and I wish we could help clarify that a little bit more, but that's the best that we've got right now. And if you have specific questions, please feel free to comment on that post that you get, and we can help narrow that down for you if we need to, okay? The next question that has come in is, what if someone at my house has COVID-19, but my child doesn't have any symptoms? Can I send other children to school, or do the other children have to quarantine? And that's actually a recent change that's come out with Texas Education Agency's public health guidance. And so we've made some changes to our COVID protocols for that. And that is requiring household contacts, that somebody that lives in the same house, if you have someone that's tested positive, then that the other students are to remain off campus during that stay-at-home period. Wendy, do you want to elaborate a little bit on what that means?
Okay, so stay-at-home period is it can change. And so again, it's important to call your campus nurse. So if you have a positive in your household, what we're going to do, or your physician or healthcare provider, if they are the ones determining those dates, they're going to look and see when was that person who was positive first having symptoms, and they're going to count from that day, and they're assumed to be positive and spreading the virus for 10 whole days from the date they first had symptoms. So that would be the stay-at-home period for the sick person. Now, additionally, because of the incubation and how long we can expect to see additional infections in close contacts, there's a 10-day stay-at-home period for those who are close contacts in the household. So it could be up to 20 days. So it's 10 days through the 10th day of the sick person, and then the other people's quarantine will begin. So the COVID positive is isolating for 10 days, but the quarantine won't start because it's thought that they can be spreading the infection through their 10th day. It gets confusing, especially when maybe mom's positive on Monday, brother's positive on Wednesday, sister's positive on Thursday. So those dates often change. If you become positive, then your dates will be your 10 days isolation, but the other family members may have that 20-day quarantine. There, in the new policy that Valerie referenced, there is an option for doing what is called a PCR test on the day after the exposure ends. So the exposure lasts for 10 days. The next day, they can have a PCR test, and that will check for an asymptomatic infection. That kind of test is not done. It's not one of the tests that we're doing here at the school, but you would have to contact your healthcare provider, a lab, to get that test done. If it's negative, you can present the test and you can end the stay-at-home period, but still be checking for symptoms on a daily basis through those full 10 days. But you would be able to return to school if you have a negative PCR test.
And also, one of the things too is we have more students and staff members that are vaccinated. There's also different recommendations for individuals that are vaccinated as well.
Yeah.
Do you want to go into that?
Sure. So if you are fully vaccinated from any of the vaccines that are currently out, so that means that you've been vaccinated with all the required doses for at least 2 weeks. So if you're fully vaccinated, the CDC doesn't recommend quarantine from a close contact, unless you have symptoms. So if the family members are vaccinated, then they're not technically a close contact that's being asked to quarantine for those full 20 days. They are just supposed to monitor their symptoms. If they have symptoms, then you will quarantine starting then. Does that make sense? Okay.
And that's why we want to keep those communication lines open, because I know this can get really complex, and our nurses have done a fantastic job, not only dealing with the day-to-day, but working to educate parents on those deadlines. And we know that sometimes it's not always what you want to hear, but we're doing our absolute best to keep everybody safe and as healthy as possible. And on that note, the next question that we have is related to the testing, which is something that we've started doing, and something that our nurses have also taken on in addition to their daily duties. Wendy, would you like to talk a little bit about the testing and who qualifies for testing and how they go about obtaining a test?
Okay, so we started with some COVID testing. It's rapid antigen testing through a program through the Texas Department of Emergency Management. We started it in the last school year for staff and staff members, this year we've opened it up for staff and students who have been sent home by the nursing staff with symptoms that could be consistent with COVID-19. So we have rapid testing available. Currently, we're doing it every day of the week. These things may change based on resources, availability of testing supplies and testing people, but we're doing them right now in the morning time. Between our staff is coming in between 6:45 and 7:30, and then we ask if you have to bring your student that you come between 7:30 and 9. We do it currently. We're doing it at the primary school, and it's on the south side of the office in the staff parking. So if you enter from the 37th Street side, like you were going to go to the first grade hallway, if you're familiar with primary school, you just keep driving straight into the parking lot. There's several handicap spots as well as, several open spaces. You would come to that location and you stay in your car. If you have a student that's enrolled in Snyder ISD, when you use the family access on Skyward, okay, you will log in and you'll see the optional COVID testing permission slip right away. It's at the bottom of the page. You click on it, and there's also a form there for optional medication form if some parents have already used that. It's right next to it. You click on it, it'll populate your student's information, and then you will enter your information as the parent and sign it for permission. The nurse will get a notification that that's been completed. And then you can go to, it's called register.txrapidtest.org, but there is a link in the Parent Square notification that everybody has received for free COVID testing. So you can click on the link. It takes about 2 minutes. You fill in your personal information, your student's information, your email. This is how you get notified with your results. You'll get an email, and you'll also receive a text with your results for that testing, usually within about 2 hours. So we're trying hard to, keep up with that, because there's lots of things going on right now. We have all kinds of illnesses, much more than we're used to seeing at the beginning of the school year. We've had RSV and colds and allergies, and for sure we've had lots of cases of COVID. So we want to make sure that those little, symptoms that people are experiencing and fevers are not COVID. So if you want to have a test for your student, if the nurse has sent your student home, all you have to do is show up, do steps 1, 2, 3, 4, 5. If you look on the Parent Square notification, it's a pretty simple process. And then just be patient. We're out there in the morning, and we're trying to get all of you taken care of, but it takes a little bit of time. So you don't have to call and ask about it. You just have to come between 7:30 and 9 if you have a student.
That's right. And I know that we gave out a lot of links there. You can find it on the Parent Square notification, and it's also on our website, snyderisd.net/COVID. There's also a quick link on the homepage of our website for COVID-19, and you'll find information on how to get tested there as well. There's one clarifying question that was asked about what if there is a close contact with a positive case at school? Is everything the same as far as, and I'm guessing what they're asking is, are they required to quarantine? And that quarantine change was just made for close contacts at home, where we're allowed to require them to quarantine or not come to campus. However, if it's a close contact in the classroom, that's not necessarily the same. That's where we notify you. It's your option. Parents may opt to keep their kids home. However, they also can continue to send them to school, but we ask that they please monitor for symptoms carefully. It's not always as easy to identify if they are, sitting right. We might know if they sit right next to them, but we may not know if they go to lunch together at high school or something like that off campus. And so with as high transmission rates as we have in Snyder, that's why we are asking you to please monitor so closely and keep your kids home if they show any symptoms. And if you have questions about that or concerns, then call the campus nurse, call the principal if you need more details about maybe what that contact was like. And we'll do the best to answer those questions as we can.
I wanted to just also just clarify on that, the testing that we're doing at the school is that rapid antigen testing. And I just want to say this, if you find out through our testing that you're positive, we are asking you, please call your healthcare provider. You know, a lot of times, especially with kiddos, they really probably need to see the doctor anyway for a lot of things. But for sure, if you're positive for COVID, get in touch with your healthcare provider because they may have some treatment options for you, but you need to act on that quickly so that you can receive the best care, the best outcomes. And you know, we really encourage you to call your doctors or whoever your normal healthcare provider is to get guidance on those things.
And that's a good point, Wendy. We are notifying the local health unit of a positive case that is tested here at the school. However, we are not notifying individuals' primary care physicians because we may not necessarily know who they all are. And the logistics of that are something that we just don't have the capability to do at this time. So we really need you to notify them. And I know Cogdell specifically has asked if we can please encourage you all to notify your healthcare provider if your child tests positive for COVID. Okay, the last question that I have right here, and we're almost out of time, but if we have any other questions come in, I'll be glad to put those out there too. Will Snyder ISD offer COVID-19 vaccinations?
Okay, so Snyder ISD nursing staff in collaboration with Cogdell Hospital and Clinics, we have vaccinated quite a few of our staff members on some on-campus vaccine clinics. I don't have any, I have some more of that planned. I don't have anything in the works as far as way of children. You know, right now you can go to Cogdell or just almost any provider in the region and get a vaccine for anybody who qualifies based on age. So those 12 and up, every day, 8:30 to 4:30 at Cogdell Family Clinic in the walk-in clinic, you can go get a vaccine. Because of the high rate of transmission in our community, I've just been telling people, even the ones who are waiting on the school nurses to do our staff clinics, please don't wait. If you think you want a vaccine, go ahead and go get it. Don't, you know, if you can, you should get it now. You shouldn't wait any longer because we have a really high rate of COVID cases right now. And the vaccine has shown to reduce this severity of the infection. And it's really helped a lot. It helps our healthcare providers out in our local hospital if we are well. So if you're not interested in getting a vaccine, then please consider wearing a mask, especially when you're around other people, because like I said earlier, you can just assume that you have been exposed to COVID in Snyder, Texas, because of our high rates right now. So we want to be very cautious. If you want a vaccine, please call the clinic, call your doctor, and don't wait any longer to go get it. It's a really useful thing.
That's true. And thank you for that. We had one more question that came in, and I understand if any of y'all need to hop off, but I want to be sensitive to time, but I do want to follow up. If the student tests positive for COVID on the school's antigen test, does that student still need to test for COVID at the hospital or clinic? And if so, what if the hospital or clinic COVID test shows negative? Will that affect the school's COVID test?
Okay, so COVID testing, the antigen testing is very, very accurate in the presence of symptoms. So if you have symptoms and you test positive for COVID on an antigen test, it's very, very accurate. It is possible to test negative either on our tests or even some of the ones that they do at the hospital. A lot of times if you are still having persistent symptoms, we're going to recommend that you retest again in 2 days. So if you have a positive though, if I'm not sure if they're asking if it would change to negative, the positive stands. So for the 10 days, if
Well, I
you're
think the question was if you test on the rapid testing a positive and then they go get a PCR and it comes back negative, does that change the way we treat our positive?
I think that the positive stands.
Yeah.
So unless the physician is going to give us a note to release that student,
Correct.
because you can test positive today and not tomorrow. The testing is much more accurate it has less false positives than false negatives. Does that make sense? So if you're,
I think the data is showing us that the testing that we're doing on truly symptomatic people, we're getting accurate results.
Yeah.
We're not getting positives, then they're going to the hospital and getting negatives.
correct, yes. And
Yeah.
I haven't seen that happen yet.
No.
But the positive is a very accurate result.
Mhm.
Okay, well, we are out of time. Are there any other comments that any of our panelists would like to make before we go?
Valerie, one, thank you for putting this together. And there may be a few questions in the chat that we didn't get to. And I'm going to assume that our public information officer will be getting those, answering those on our Q&A page.
Yes.
Yeah.
And I know some of these folks, so I'll get back to them individually as well.
Yeah, and I just want to say, I think we very much are driven by data. And I think the data shows that the one common data point that seems to be working is what Wendy, Nurse Prince touched on, is vaccinations. It's reducing the severity of the illness, if not stopping it completely. So I believe in freedom of choice. I've said that all along. I would ask you, if you're choosing not to, please make sure you understand the ramifications of making that choice.
That's right. Well, I want to thank all of you for your time and for our attendees as well. I appreciate that you've made the time to learn more about what's going on and the efforts we're taking. We ask that you please as well make your best effort to make sure that we're slowing the spread of COVID in our community and our schools. If you have any questions at all, please reach out to your campus nurse. You can email questions@snyderisd.net. If you have any follow-up questions today, we're always glad to answer those. So thank you very much and stay safe.